Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Primary hyperparathyroidism. Primary hyperparathyroidism, it mainly occurs due to the increased parathormone production. Where whatever the reason is, there is increased parathormone production resulting in primary hyperparathyroidism. Here it is more commonly seen in women than in men, and the most common cause of increased parathyroid hormone production is actually solitary adenoma in almost 80% of cases. And this solitary adenoma is also most commonly seen, or it is most commonly located in the inferior parathyroid glands most commonly. So whenever there is increased parathyroid hormone, what happens? So actually whenever there is increased parathyroid hormone, this leads to the parathyroid hormone causes increased calcium absorption from the intestine. It causes increased calcium reabsorption from the kidneys, thus resulting in hypercalcemia. So this hypercalcemia will result in increased gastrointestinal absorption of calcium. It can cause increased production of vitamin D3, and it will result in reduced renal calcium clearance. These are the three things which are seen in hypercalcemia. So, in hyperparathyroidism, what are the main etiological features of hyperparathyroidism? Hyperparathyroidism occurs mainly because of the following things. 1. Exposure to low dose therapeutic radiation. Whenever the patient is exposed to low dose therapeutic ionizing radiations, or if the patient has familial predisposition, there can be hyperparathyroidism. It is associated with renal leak of calcium, or whenever there always in some of the cases there is decreased renal function is seen with age. So because whenever there is decreased renal function, then calcium excretion is hampered, so calcium has been absorbed in the body, resulting in hyperparathyroidism. Lithium therapy can cause hyperparathyroidism, and there can be altered sensitivity of parathyroid glands can also be seen, resulting in hyperparathyroidism. So here actually hyperparathyroidism in these conditions is due to the decreased calcium. If you have to say, see, whenever there is low therapeutic ionized radiation, there is hyperthyroidism. Whenever there is renal leak of calcium, calcium is excreted, thus resulting in hypocalcemia, which can result in hyperthyroidism. Similarly, declining renal functions will also cause calcium excretion, resulting in hyperparathyroidism. Whenever there is altered sensitivity of parathyroid glands to the suppression of calcium, so whenever there is less calcium, obviously the parathyroid glands will become activated, resulting in hyperparathyroidism. Actually these are most commonly secondary causes of hyperparathyroidism. The most common primary cause of hyperparathyroidism is mainly genetic, which is sporadic in nature. This hyperparathyroidism is also associated with other genetic syndromes, like it is also associated with men 1 syndrome. Okay, this hyperparathyroidism is also associated with the following syndromes. It is associated with men 1 syndrome, men 2A. It is associated with isolated familial hyperparathyroidism, and it is also associated with familial hyperparathyroidism with jaw tumor syndrome.
thank you and thank you for watching.